Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Semen analysis. According to WHO 2010 parameters of normal semen analysis, the following are the lower limits of the normal. First, volume of the semen should be more than 1.5 ml. pH of the semen should be more than 7.2. Sperm concentration should be more than 15 million per ml and sperm count should be more than or equal to 39 million per ejaculate. So average sperm count is 60 to 100 million per ejaculate. Sperm morphology strict criteria, it should be more than 4% of normal. Total motility of the sperm should be more than 40% and progressive forward motility should be more than 32%. Viability of the sperm should be more than 58%. WBC count should be less than 1 million per ml. Drug of choice for any infection in male genital tract is doxycycline. Total number of round cells are less than 5 million per ml. Round cells constitute WBCs and the granular sperms.
thank you and thank you for watching.